This hospital will raise the bar in terms of the delivery of private healthcare standards to its highest form.
Anything you can think of, you have the best of the best working in this hospital.
Patients deserve the best of technology and the best medical care.
It's a very beautiful place.
I'm Dr. Tan Seeling. I'm the Group Chief Executive Officer and Managing Director of Parkway Pantai Limited, the holding company that built this hospital. I believe that this hospital would put Singapore on the world map. We've invested in state-of-the-art technology, medical equipment, and the entire hospital is built centered around the patient as our main focus.
I think being a patient at the hospital is really an experience for all the senses. I feel really at ease here. There are a lot of green spaces around the hospital which my family and I can relax in, and it really cheers a patient up to have sunlight streaming through the windows and you can't even feel the heat.
We believe that the healing of a patient's illness itself is a very holistic process, and we hope that this becomes an oasis of healing, an oasis of calm. So while we put in the best medical equipment, we have the best doctors and nurses taking care of the patient, we also believe in using the environment, making it a very, very comfortable, private environment for the patients to recover. The team spent no effort in scouring the world to find out what is going to be cutting edge and what is the future that's in store in terms of medicine.
Welcome viewers to a special health episode, Doctor's Voice. I'm sure by now you all know that this program has primarily been designed to interview doctors visiting us from abroad, especially from Parkway Hospital. And through them, we come to know the recent advances in medical technology and treatment. I'm Dr. Zareen Mahboob, and I would like to welcome all of you to this special health episode. We are honored today to have amongst us two very distinguished doctors. Firstly, Dr. Tang. He is a senior consultant in general surgery, and he has a magnificent academic background, having passed from Imperial College with distinction in MBBS and being trained under his mentor, Professor Ko Chi-Soo. And his interest is in GI and hepatobiliary surgery and his cancer treatment. He is also the founder member of the first liver transplant team in Singapore General in 2005. We have Dr. Chuang. He is a consultant cardiologist, also having a magnificent academic background. He has had training from the world's #1 heart center, the Cleveland Clinic Foundation, with subspecialty in cardiac failure, in heart transplant intensive care, in genetic heart disease, and sudden cardiac death. So viewers, stand by as we ask them some wonderful questions and let's enlighten us by hearing from them. Dr. Tan, your interest is obviously liver and hepatobiliary pancreatic surgery. So what are the common causes of liver cancer?
Okay, when a patient comes to us with liver cancer, essentially there are two types. There's what we call the primary liver cancer, where the cancer arises from cells within the liver itself. Right. The other type of very common liver cancer is secondary liver cancer, where the tumor arises, for example, either in the colon or in the stomach, but the disease has spread and ended up in the liver. So I shall talk about primary liver cancer because that's what we do see in large numbers of patients. It's quite easy to identify patients who are at risk of primary liver cancer. These are patients who have, for example, the hepatitis B virus, either as a carrier who is active or an inactive carrier. These patients have a risk factor in excess of 50 times the normal population. A hepatitis C carrier, or a patient who has had their liver damaged, for example, from things like alcohol, in which the liver has become cirrhotic. So these are the common risk factors for patients with liver cancer.
Okay, thank you, Dr. Tang. Yeah. Dr. Chuang, what are the common causes of heart disease? If you could just give us a broad outline.
Certainly, my pleasure. Now, heart disease can be broadly categorized into three groups. First, that of a structural heart disease. Second, that of electrical problems of the heart. And that third, that due to a blocked arteries, coronary artery disease. Under the category structural heart disease, you can have many different subsets of problems. For example, one can have valve problems that affects the valve, opening and closure. Another set of common problems is that of congenital heart. People might present with holes in the heart or other congenital heart problem. And thirdly, patients have genetic heart disease where the heart muscles are not abnormal. And this is a big problem because a third of the young adults who die suddenly during exercise are due to this class of genetic heart disease problem. A second set of heart problems is that due to electrical rhythm, something more commonly seen in the elderly population. Having said that, the younger ones also have electrical problems of their own, such as extra or accessory pathway that can give rise to short circuit systems within the heart and give rise to symptoms such as palpitation. For the elderly population, one of the biggest problems we face when we grow old is that of irregular heartbeat. And by the age of 70 to 80, about 10% of the elderly populations may have irregular heartbeat, which may affect their heart function, but also it put them at risk of stroke.
Okay.
Now the third and most common problem is that of coronary artery disease, which accounts for more than 50% of all heart failure as well as sudden death in the adult population. And this obviously is a big issue in every developing countries because of our lifestyle and our multiple risk factors.
Okay. Thank you so much. Dr. Tan, since it's about liver cancer and hepatobiliary pancreatic surgery, so what advanced treatment and diagnostic procedure do you usually do in your hospital?
Okay.
How is it different from us?
Well, the diagnosis of liver cancer has moved forward quite a bit in the last decade or so. Nowadays, we no longer need to do a biopsy to make a diagnosis in liver cancer. A good quality CT scan done correctly or a good quality MRI scan done correctly is able to diagnose liver cancer quite accurately in more than 95% of patients. So that's certainly an advance because we don't need to do an invasive procedure now to make that diagnosis. In terms of treatment, you can broadly divide them into the surgical treatments and the non-surgical treatments. And both have had advances. For example, some good non-surgical treatments that we do routinely involve either burning the tumor with something called radiofrequency ablation or very localized and selective installation of chemotherapy directly into the tumor cells of the liver without damaging the rest of the liver or the rest of the body. So these techniques have been now quite well perfected. There's a brand new novel technique to treat liver cancer in which we are able to deliver radiation which are prepared in microspheres directly into the tumor. And this has been quite an advance because previously large tumors could not be treated in this way, but nowadays they can be delivered selectively into the liver cancer, and this has seen quite dramatic results. The other group of treatment involves surgery, of course, and I think surgery has also come a long way. Previously, people were afraid to do liver surgery. It was dangerous and people lost a lot of blood doing it. But nowadays, liver surgery is very safe. Most patients are able to undergo liver surgery without much blood loss and without even ending up in the ICU. So that is a major advance. And then finally, I think liver transplantation as a way of replacing the damaged liver together with the tumor is something that is certainly improved leaps and bounds in the last decade or so.
Okay, we'll get back on the liver transplant thing at the end. Dr. Chuang, what are the precipitating factors of heart disease?
Now, if you look at non-congenital, that means something that you're not born with. You just look at acquired heart disease, of which a major concern is that of blocked arteries. We know the major risk factors are the same in every country. Number one, that of a diabetes. If one has diabetes, one's risk of heart problem is higher, especially so in ladies as compared to men. When ladies have diabetes, their risk of coronary artery disease is 4 to 7 times higher as compared to those without diabetes. For men, if you have diabetes, your risk is 2 to 3 times higher compared to those without diabetes. Now, other risk factors are hypertension, poorly controlled hypertension can pose a stress to the heart. High cholesterol levels is a big issue in every country, especially with more diabetic patients, and patients, many of the population are so tied up with work that they are too lazy to exercise, and plus the food intake. Food is often a source of problem, and we know that it can lead to high cholesterol on top of the genetic predisposition to high cholesterol levels. Other problems that might lead to heart problem are stress, the type of personality that you live, the type of personality that you are, and a strong thing is that of a family history. So usually we will encourage those people with a strong family history of heart disease, diabetes or high cholesterol to start checking on themselves much earlier in their life as compared to other populations.
How early, like from what age?
Now if I look at the trend of coronary artery disease throughout the world, you realize that in Bangladesh as well as in Singapore, we are getting people having heart attack at earlier and earlier stage in their life. I get a lot of patients with heart attack at the age of 30, no longer 40s and 50s like our dad and our parents. So it is important that if you have a family history, that you start screening yourself as early as 20 to 30 years old. Go for regular blood tests to see where you are. But if you have strong family history of heart disease, then you might want to do some heart-specific tests or investigations starting at age of 30. It's never too late.
It's never too late. Okay. দর্শক মণ্ডলী, আমরা ডক্টর ট্যান আর ডক্টর চুয়াং এর কাছ থেকে জানতে পারলাম, ডক্টর ট্যাং এর কাছে জানতে পারলাম যে লিভারের ক্যান্সারের কারণগুলি কী এবং সিঙ্গাপুরে কী ধরনের ট্রিটমেন্ট আমাদেরকে অফার করতে পারে তারা যদি আমাদের রোগীদের লিভার ক্যান্সার হয়ে থাকে, এবং ডক্টর চুয়াং এর কাছ থেকে জানতে পারলাম হার্ট ডিজিজ কত ধরনের আছে এবং এটার সাথে লাইফস্টাইল, খাদ্যাভ্যাস এবং লাইফস্টাইল বলতে যেটা বলছে যে যারা লেজি, যারা এক্সারসাইজ করে না তাদের প্রবণতা বেশি, এবং যাদের জেনেটিক ফ্যাক্টর অর্থাৎ যাদের বাবা মায়ের হার্ট ডিজিজ থেকে থাকে তাদেরকে 20 থেকে 30 বছর বয়স থেকেই হার্ট স্ক্রিনিং, ব্লাড টেস্ট, কোলেস্ট্রল এগুলি সব দেখে নিতে, যাতে করে তারা এইসব লেভেলগুলি নর্মালে রাখতে পারে। আমরা ছোট্ট একটি বিরতি নিচ্ছি, বিরতির পর আবার ফিরে আসবো এবং আবারও তাদের সাথে কথা বলবো, সাথেই থাকুন।